And then the other thing, of course, is that you have to identify the nature of the psychological problem and the psychological injury and damage, and the extent of that psychological damage, and how permanent that psychological damage is. Now, this area of assessment is not new to us. I mean, this is what we do all the time. So we use the clinical scales of the MMPI, for example. We use our interview strategies and techniques. I like to use some of the structured interviews that are present now that are very good for diagnoses. Like, for example, the SCID, which is a diagnostic interview produced by the American Psychiatric Association that goes through a list of over 100 questions, but that allows you to make a diagnosis based upon all the criteria in the DSM-4R. So I like that. And you use all the tools that we would normally use in diagnosing any kind of psychological trauma or emotional problems or cognitive impairment or behavioral discontrol. Now, if the issue involves cognitive impairment, I always recommend that you use, if you're not familiar and if you're not trained and skilled with neuropsychological tests, that you use a neuropsychologist as a consultant. I personally like to use the WASI, which is a shortened version of the WACE, or the WACE itself, but that's not enough if indeed the cognitive impairment is the issue at hand. For example, I had a couple of years ago a person that was a bricklayer, and he was working down below, and somebody was working on scaffolding up above, and so a bucket of paint or a bucket of mortar fell down and hit him on the shoulder and on the head, and he had significant cognitive impairment, severe memory problems. He could no longer sequence in his thinking, and so he had a difficult time laying bricks or even planning out what he was going to do during the day. And so that was a case where it was necessary to document very clearly with neuropsychological testing the extent of his impairment and the permanency of his impairment. And so I used a neuropsychologist as a consultant. And when you do that, you can either ask the attorney to pay for the consultant, or you yourself can sort of subcontract with that neuropsychologist. And I've done it both ways. And either way works as long as you have that input when you yourself are not a neuropsychologist. Fortunately now we are having more and more forensic psychologists that both have expertise in forensic psychology and neuropsychology, and so they can do, you know, the total assessment. But if you don't have that neuropsychological expertise, then I think it's important to bring on a consultant. There are some other tools that, you know, typically we should consider using, such as a good personal history form, a good medical history form, maybe a major life events questionnaire that looks at traumatic things that have happened to them over the course of the last year, a work history form, and there are all kinds of standardized forms that you can use. I have kind of come up with my own forms with some of these, and I've used some standardized forms with others because they are so good, and so I just have used those forms. A form that also a test that sometimes I use is the scale of dissociative activities, the SODIS scale, which was published in 2003 and that is in the public record. With many instances of post-trauma stress, you do get senses or sensations of dissociation, where people feel like they're not in their body or they're unease in their body. And so when that occurs, when you pick up those kinds of things in an interview, giving a good dissociation scale to help you to kind of come to a conclusion about the reality of those dissociation symptoms could be very helpful. I found the SODIS very, very helpful.